Good morning and welcome to Health and Social Services for March 6th. Can I have the roll call, please? Thank you. And is there any declarations of pecuniary interest? Hearing none, I have one amendment to the agenda, and it's a delegation, and it's Mr. Richard Ward. So we will need 2/3 in order to add to the delegations. Can I have a mover? Chair Henry and Councillor Anderson. Any opposed? Not hearing anything. Mr. Ward, you will be under delegation 6.3. Next, we're moving along to adoption of the minutes. February 6th, can I have a mover? Councillor Anderson, seconded. Chair Henry. Is there any questions? Any opposed? And that's carried. So we have statutory public meeting, and it's the amending of the bylaws of 18-98, 19-98 to update fees for health protection regional activities and Ontario Building Code activities. I'm just going to read out loud that this portion of the meeting constitutes the statutory public information meeting under the Building Code Act to pass a bylaw to introduce a new fees and change the existing fees charged for applications and other services under the Ontario Building Code related to on-site private sewage disposal systems and associated regional activities. The public has been given notice via advertisement online with the Metroland Media and in local newspapers beginning on February 13th, 2025. I'm going to now turn to the public and ask, is there any member of the public at this meeting wishing to appear on this matter? Once again, I'm going to ask, is there any member of the public who is here on this matter or online? And for a third time, is any member of the public here or online that wishes to speak to this matter? So seeing we have no members of the public who are present or online that are needing to speak to this, we will continue with our agenda. Moving on to presentations and, oh, sorry. I have to move the report. Chair Henry, seconder. Councillor Dyes, is there any questions on the report? Any opposed? Hearing none, we're moving on to presentations. Moving over to 5.1, Jasmine Bond, Manager Population Health, and Marina Lee, Manager of Health Protection. Good morning, and you have 10 minutes.
Good morning. Just make sure we got that. Is that on? Good morning, Honorable Chair and members of Health and Social Services Committee. Thank you for the opportunity to present on the Infectious Diseases Prevention and Control, or IDPC, programs today. I'm Jasmine Bond.
And I am Marina Lee, and we are both managers of the IDPC programs, and we are delighted to be here today. The purpose of our presentation is to provide an overview of the IDPC programs and share some highlights and future directions on how we contribute to safeguarding our communities here in Durham Region. The purpose of the IDPC programs is to reduce the spread of infection and improve the health of people who are already infected. The goal of our programs is to follow up on infectious diseases to monitor their spread, identify potential outbreaks early, and implement necessary interventions to prevent further transmission within the community. We protect the public's health by quickly identifying and containing infectious disease cases, providing accurate information, ensuring access to necessary medical care, and coordinating with other agencies to manage and contain infectious diseases. We are at our best when we remain largely invisible, following the public allowing the public to go about their daily activities without concern for safety for our food, water, fresh air to breathe, and with the ability to greet one another with hugs and handshakes. For our legislative requirements, you may already be aware of the Health Protection and Promotion Act and the Ontario Public Health Standards, which serve as our primary legislation and guidance.
The diseases on this list are designated as diseases of public health significance because of their contagiousness, severity, or frequency. All suspected and confirmed cases of these diseases must be reported to public health in a timely manner to enable our prompt follow-up. We update and distribute this list to our staff and post it on Durham.ca. We advise healthcare providers and labs to be aware of this list and remind them to report these diseases to us. This list is very important because it represents an intersect between health professionals working in the community in primary care, hospitals, and labs, and our teams who work in our IDPC programs. We can only do our work when we are made aware of the disease, and in turn, we then support the community healthcare providers with public health recommendations and guidance. A sporadic communicable disease is what we say when an infectious disease occurs occasionally and irregularly without a pattern of transmission or geographic concentration. For example, most cases of tuberculosis, giardia, and invasive group A streptococcal infection occur sporadically in Ontario and are not linked to each other or to a common source of infection. The key to managing sporadic diseases is a well-functioning disease reporting system, rapid investigation of the case, targeted interventions to prevent further transmission of that specific disease, and education about preventive behaviors, like staying up to date with immunizations. The role of our IDPC teams in sporadic communicable diseases is primarily case and contact management. Case and contact management is an intervention where public health staff works one-to-one with the person who is sick with the disease, also known as the case. We interview them to find out details about their exposures, symptoms, travel history, and their close contacts. Sometimes our investigation results in identifying the source of the disease, and other times it does not. Next, we contact trace, which means finding and notifying anyone who may have been exposed to the case while the case was contagious. We provide contacts with advice about monitoring for signs and symptoms of the disease and provide guidance on other preventive measures, such as antibiotics, vaccination, or immune-boosting blood products. In most situations, isolation is required for the case to prevent further transmission to others, and depending on the setting, this may involve limiting visitors or moving the individual into a special room. While our prevention approach to case and contact management is designed to protect the public and reduce the spread of infectious diseases, some situations result in clusters of cases that require further investigation to determine if it meets the definition of outbreak.
To give you an idea of the sporadic infectious disease activity in Durham Region, we have included this graph that represents the number of all diseases of public health significance investigated by Durham Region Health Department between 2014 and 2024. As you can see, there was a significant jump in activity during the pandemic between 2020 and 2022. In 2020, 67% of sporadic diseases were COVID-19. This increased to 88% in 2021 and 87% in 2022. The sharp drop in 2023 was a result of the changes to the ministry guidance for COVID-19. This graph shows the trends of sporadic diseases excluding COVID-19 cases, and as you can see, the increasing trend was disrupted during the pandemic. Usual sporadic infectious disease activity was lower, which may be due to gathering restrictions, lockdowns, and masking requirements, which play a role in the prevention of many of the diseases of public health significance. However, post-COVID-19, as of 2023, you can see sporadic diseases are trending upwards again from their previous peak in 2019.
I'm going to highlight our work in tuberculosis, or TB now, which includes 4 main areas of public health action. The first area is identifying and managing active TB cases, which lasts on average 6 to 9 months per case and includes provision of directly observed therapy to ensure patients take their medications correctly. We also monitor their symptoms and side effects to the medications to prevent complications and liaise regularly with the specialists at Lakeridge Health. We identify and test TB contacts to determine if spread has occurred, and we provide ongoing education and emotional support to a family affected by TB because the recovery is often long and can have ups and downs. We stay involved until the disease is fully treated. We also manage latent TB infections. that is when the TB bacteria is in their body, but the person is not sick and cannot spread TB to others. This is an opportunity for us to encourage treatment to kill the bacteria before it can cause problems in the future. Finally, when someone moves to Canada, they go through a medical exam as part of the immigration process. If the exam shows the person may have had TB in the past or is at risk of developing active TB in the future, they are flagged for medical surveillance by public health. Another highlight is our programming for sexually transmitted and bloodborne infections, or STBBIs. This includes promoting healthy sexuality and safer sexual practices when we are working with cases, contacts, and priority populations. We manage cases of STBBIs by phone, virtually, or in person at our sexual health clinics. We also coordinate with local healthcare providers to ensure cases receive appropriate treatment and counseling, including partner notification.
Public health units play a crucial role in managing outbreaks in congregate living settings, such as long-term care homes, retirement homes, group homes, and shelters, as well as childcare settings and suspected foodborne illness outbreaks. In 2024, we declared 445 outbreaks. Since the onset of COVID-19, outbreaks have been in the spotlight, highlighting the importance of rapid response and effective outbreak management. To provide a more specific breakdown on our actions, I have identified them in the following 6 categories. The first category is to assist with identifying the outbreak, investigating the source and extent of the outbreak, advising on implementing control measures, and monitoring the spread and tracking the cases and contacts. The next strategy is infection prevention and control, which is to ensure that facilities adhere to proper hand hygiene, use of personal protective equipment, environmental cleaning and disinfection, and isolation procedures for all ill cases and contacts. Surveillance and reporting focuses on the proactive detection and monitoring of outbreaks. Public health units helps advise our facilities on surveillance to identifying potential outbreaks early. Once an outbreak is detected, it must be reported to the Ministry of Health and maintain detailed records of the outbreak's progression and the control measures being implemented. Communication is important to providing timely updates and information about the outbreak. Here in Durham Region, we have a daily outbreak summary report that is sent to community partners and updated on our webpage daily. The next strategy is support and resources, which are provided to our facilities during an outbreak, which may include supplying personal protective equipment, test kits, and offering training on infection control practices. And lastly, data management, which involves ensuring that all relevant information about the outbreak is accurately and promptly documented. Ontario Public Health Standards requires public health units to provide after-hours response to ensure timely and effective management of public health emergencies. This means that public health professionals are available 24/7 to address urgent public health issues such as outbreaks, infectious diseases, and other environmental hazards. The goal is to minimize the impact of these emergencies by providing immediate support and intervention. This continuous availability is crucial for protecting public health and ensuring the safety of the community. Here in Durham Region, the common after-hours calls we receive are outbreak reporting, rabies post-exposure prophylaxis requests, and infectious disease reporting. In 2024, we received 689 after-hours calls.
We're going to share a few trends in local infectious diseases now. The first trend I wanted to talk about is this spike in cases of invasive group A streptococcal infections, or IGAS, that occurred in 2023 and 2024. The group A strep bacteria can often be found in the throat and on the skin, and the most common illnesses caused by this bacteria are strep throat or impetigo. In rare cases, though, when the bacteria enter other parts of the body, it can cause an invasive disease, which can result in life-threatening illness. This is why it is one of the diseases that is immediately reportable to public health. This increasing trend post-COVID-19 has been observed across Ontario and other regions around the globe. Pre-COVID, we would manage on average 30 cases per year. As you can see, we peaked in 2023 with 107 cases, and in 2024 came back down to 77. A second trend you may have heard about in the media is the increasing measles activity occurring in every region of the world due to global travel and low vaccination rates. In 2024, there were 64 cases of measles in Ontario. Our IDPC team works closely with healthcare providers to ensure anyone suspected of measles is tested and isolated until test results are returned. We had 52 individuals suspected of measles reported to us last year. However, only one was a confirmed case.
Another trend I wanted to present is Lyme disease. Over the past decade, Lyme disease cases in Durham Region have significantly increased. The largest spike occurred between 2020 and 2021, with cases rising by 82% from 62 to 115. This surge may be linked to the pandemic as more people spent time outdoors, and the continuous increase may also be contributed to climate change, such as warming temperatures, which makes it more favorable for ticks, which allows ticks to be active all year round. This trend highlights the need for ongoing public education, surveillance, and guidelines to prevent vector-borne diseases. Public health efforts have included raising awareness among healthcare professionals for early detection and treatment. A few highlights that I wanted to mention. In 2023, the Ministry of Health designated anaplasmosis, babesiosis, and Powassan virus as diseases of public health significance due to their increasing prevalence, largely driven by the expanding range of black-legged ticks. Warming temperatures and land use changes have contributed to this spread, raising the risk of human infection. In 2025, Candida auris was another disease that was added to the diseases of public health significance due to its emerging threat and the challenges it poses in healthcare settings. C. auris is an emerging fungus known for its resistance to multiple antifungal treatments and disinfectants, making it difficult to control. It can cause severe bloodstream, wound, and ear infections, particularly those in hospital with weakened immune system, and has a high mortality rate.
On behalf of Marina and myself, we would like to extend our heartfelt thanks for your time and attention today, and we hope you found this presentation informative.
Thank you, Jasmine and Marina. And we have Mayor Carter.
Morning, Madam Chair. How are you this morning?
I'm well. How are you?
I'm fine, thank you very much. Just a real fast couple of questions. I just want to pick up on the Lyme disease. Where is Lyme disease mostly found? Is it grassy areas, forest areas? Is it where do you find these ticks that cause Lyme disease?
Thank you for the question, and through the chair, mostly in the woodsy areas, a lot of our trails, parks right now. Currently, there's also issues in people's backyards. I know that over the last year, there has been a lot of questions about people finding them in their backyards. So really, essentially, it's in almost any area with trees or grass, things like that. So that's why it's important for public awareness on identification and ways to prevent Lyme disease.
Beautiful. And I know a little bit about Lyme disease, but it can be quite serious, can it not? I mean, I've heard of people that it takes a long time to really identify Lyme disease in some circumstances, and the longer it goes on without being diagnosed, the illness gets worse. Am I correct by that?
Thank you. And again, through the chair, I believe we've tried to educate healthcare professionals on early detection and treatment. From what I believe, from us investigating a lot of Lyme disease cases, the symptoms can be very long before they are officially diagnosed. That's from what I believe to be true. But
And can they be serious? Can this particular thing, can it be like can it be debilitating? How bad can it get?
From the cases that we've investigated, some of the symptoms we've seen in cases have been quite severe, like muscle debilitations and things like that. But since I'm not a medical professional, I'm not really sure the severity of the symptoms.
I appreciate your efforts. Thank you, Madam Chair, and thank you for the presentation. Great job.
Thank you. And Councillor Anderson.
Thank you, and thank you for the presentation. And it couldn't come at a better time. So my question to you is, I know folks vaccination, I guess since COVID, folks are not eager to get vaccinated anymore. And I guess a lot of that is coming from south of the border, so to speak. Are you going to have some kind of promotional piece to encourage folks and express the importance of getting vaccinated?
Thank you for the question. And through the chair, we are actively promoting immunization, particularly in terms of catch-up for anyone who was unable to be up to date during COVID when our attention was redirected. It's certainly a big part of our measles messaging right now to know your vaccination status, visit your healthcare provider to understand that, and for other diseases as well.
Yeah, and just as a follow-up, and folks are linking it to autism, which there is no documented evidence that that's the case. And I've had calls, and I've spoken with residents that have shared that concern. Is there anything you can do to dispel that myth?
Thank you for the question. And again, through the chair, we do work actively to dispel that myth. We have a lot of information posted on Durham.ca. We have an immunization program. People can reach us through the Durham Health Connection line. There are lots of ways to reach us to find out information about the safety of our vaccines.
Okay. One last question, Chair.
Sure, go ahead.
Are there any cases of measles reported in Durham region? I know I saw that there are 9 cases in Eastern Ontario, so I was just wondering.
Yes, thank you. We have only had one case. That was last year. So far this year.
Nothing? Okay. Okay, thank you very much.
Thank you.
Thank you. Councillor Wu.
Yeah, good morning, and through the chair, and thank you, Jason and Marina, for your presentation. Just a couple of questions, and one slide you had about congregate living settings. Now, there's probably no other place probably where you have such a big gathering as in schools. Do you go into the schools?
Thank you for the question, and through the chair, just to clarify the question, is it about, that slide was about outbreaks, or is it the question about schools and outbreaks?
Yeah, going into schools and even prior the education portion.
Well, we do a lot of communication with our district school boards to identify, communicable disease spread and advising on IPAC measures. We get involved with IPAC questions and related to that. Yeah, that's what we currently are doing to support our school population, because we do recognize that it's, in terms of the definition of a congregate living setting, it's long-term care, retirement. In schools, yes, they can congregate, but they don't live there. But there's many measures that we can help with them in terms of any IPAC-related concerns by providing them with resources and presentations and things like that. And I think Jadson could add something to that.
Yeah, there is an example. So if there is a case of an infectious disease in a school, we are in communication with the principal, and it is determined together whether or not the rest of the kids in the classroom or beyond the classroom need to be notified of a potential exposure. And they'll be given public health recommendations about whether they need to look up their immune status or just monitor for signs and symptoms, or in a very extreme case, if they need to receive preventative antibiotics.
Right. And there's one slide, investigation for group A strep, the IGAS. And now, would that be connected and lead to, I'm going to use the term flesh-eating disease?
Yes, thank you for the question. It is. That is one of the most extreme forms of the infection.
And then I guess, then I'm going to use the term sepsis. And I know of a person that relatively young, in the 40s, that did have cut and bacteria got in and developed sepsis and passed away. So this flesh-eating disease in this, do we have many cases of that, or probably not in Durham region?
So before COVID, I mentioned we managed an average of 30 cases a year, of which a small proportion are the more extreme variety that you're expressing there, flesh-eating disease or toxic shock syndrome. The number is increasing, and it's not just in Durham region, it's across the globe in different regions. And so a proportion of those are always that more extreme variety.
Okay. And the last question, again, we have a great agricultural population, and the fear amongst them is this bird flu or avian flu. Have we had any cases in this area? I know there's a concern, but have there been any issues? And again, they've talked about the avian flu transmission from birds into animals, into cows.
Yeah, currently, sorry, through the chair, we don't have any active or had any avian influenza human cases. We have been ramping up and trying to educate the public and revamping our web pages to ensure that the information with avian influenza is current and up to date. As you can see, it's a very popular topic, and it's always evolving because the status kind of changes daily. So currently, Durham Region, we're lucky enough that we haven't had any active human cases yet, but we are still trying to, again, educate the public and provide resources. Yeah.
Okay, thank you very much. Thank you. Thank you, Chair.
Thank you. And any further questions? Seeing none, hearing none. Thank you very much for your presentation.
Thank you. Thank you.
I'm going to now move on to Lisa McIntosh, our Director of Income, Employment, and Homelessness Supports. This is a presentation on the Durham Region Encampment Strategy. Good morning.
Good morning. Thank you to the committee chair and the members of Health and Social Services for offering me the opportunity to present the Durham Region Encampment Strategy this morning. So the objective of the encampment strategy aligns with meeting the recommendations in the Durham Region Integrated Homelessness Action Plan, presented to Council in December 2023. And it aims to address unsheltered homelessness specifically related to the complex dynamics of encampments. The strategy establishes that the region does not endorse or approve of encampments and aims to eliminate them by expanding shelter, supportive and deeply affordable housing, and coordinating health, social, and justice system services to support community wellness. The approach we use to develop the strategy is represented here in this circular representation, because we will continually work to improve the strategy over time. To develop the strategy, we worked with a consultant to support us to bring together health, social, and justice system representatives, because we were committed to co-producing and working together with local area municipalities, including the 8 local municipal fire and bylaw teams. Adopting a human rights-based approach within the strategy does not mean that there are no limits for people experiencing unsheltered homelessness. It means that we work to engage people addressing their needs and notably recognizing there is a shortage of affordable housing and shelter options in the system as we develop action plans with them. The region is the system manager for homelessness, with a legislative responsibility to support the needs of vulnerable people experiencing homelessness or at risk of becoming homeless. We are committed to balancing the needs of vulnerable people experiencing homelessness and overall community well-being in our endeavors. We leverage evidence-based solutions using data and best practices in our work. Our work on the strategy included extensive partnering and consultation, including key informant interviews and focus groups with local area municipal staff, regional services, and the unhoused community through the Regional Gap Committee. The consultation focused on gathering new information to ensure we respected and maintained the local bylaws, fire codes, Health Department, Durham Regional Police Services, and legal requirements. We also gathered information from people with lived experience about how to motivate people to move indoors. We reviewed information related to any messaging that we have from community members and our contacts with local businesses during the process. Homeless encampments are a reality due to the lack of affordable housing and space. Encampments are not endorsed as a solution by the region for this strategy. Encampments are used to address them with an aim to eliminate encampments. The lack of affordable and attainable housing across the spectrum in Canada is a social and economic crisis that leaves many individuals unhoused and in need of support. Encampments are defined in many ways across Canada and our provincial government here in Ontario, as well as across our provinces. The engagement process and feedback we receive from invested parties was used to establish a definition for homeless encampments for Durham Region. A homeless encampment is defined in the region as encroaching or making exclusive occupancy of a space constituting one or more person or people with belongings that have a high degree of mobility. In 2024, 98 encampments were documented, monitored, and action occurred to move people along the housing continuum and away from encampments or outdoor living. 53 sites were abandoned or dismantled. 44 remained active at the end of the year, and 80 individuals were present and accounted for during outreach visits. Area municipalities and property owners work to dismantle them, and we work with the people in them to help them create those action plans and move along. The data on the slide also represents information on encampments by municipalities. In response to the growing challenges posed by encampments, Durham Region has implemented a comprehensive approach that aligns with Durham's Integrated Homelessness Action Plan. The approach highlights 4 strategic priorities. These priorities guide the efforts to address the needs of people experiencing unsheltered homelessness in the region. Community building and engagement initiatives include the development of a community education campaign for both housed and unsheltered residents to really prompt discussion and thinking about the issues related to housing and homelessness and provide information. A Stories of Resilience video series has been launched to provide an opportunity for people who have experienced or are experiencing unsheltered homelessness to have a voice and to reduce stigma. We also regularly present in the community at regional and local councils and visit local businesses. We meet regularly with the local area municipalities and community service providers. Expanding housing projects to bring people indoors includes reducing barriers in shelter to improve accessibility and safety, and actively exploring opportunities to expand emergency shelter, supportive, and transitional housing options. We are working to increase coordination across agencies and service sites to maximize access and efficiency. Ongoing efforts to enhance services to support people with access to health care and support physical conditions, mental illness, and addictions by partnering with health service providers is occurring regularly. In 2024, mobile clinics operated by both Durham Region paramedics and Durham Community Health Center began bringing primary care to folks in encampments and unsheltered settings. Efforts are, for legislative policies and people's rights, efforts are underway to coordinate our regional system policies to streamline responses. For example, new shelter and warming center standards will roll out in 2025. The strategy clarifies an encampment reporting process to provide basic information. The process provides information that is reflective of the overlapping practices and processes across all 8 local area municipalities. Bylaws and expectations such as timelines for the process may vary across local municipalities. However, the sequence of events tends to be consistent. The regional team aims to support people with services in a way that aligns with demands that exist for each encampment and community across the region. Roles and responsibilities are set out within the document at a high level. Resources for managing encampments on public land is outlined. The region is the legislative service system manager responsible for tracking encampment locations and monitoring health and safety issues. We collaborate with fire, bylaw, paramedics, primary care outreach to support the unhoused community. There are many other partners involved as well. We assess and offer safety tips and offer housing-focused supports to move people along and end their homelessness. The local area municipalities also identify and track encampment locations, monitoring health and safety issues, and sharing information back and forth between the region and the local communities. They provide notice to vacate an encampment. Some municipalities do this very quickly and immediately, while others take a graduated or an impact assessment approach. The regional team moves to support the encampment residents and prepare and manage them to move with the aim of supporting them to move indoors when possible and following the timelines of the local area municipality. They respond, and the local area municipalities respond to breaches of local bylaws and lead active cleanups and dismantling of encampments. They communicate bylaws and policies to the public. Local fire provide fire-specific safety education and response. Durham Regional Police will respond to requests for assistance in accordance with the law and operational considerations. Our primary care outreach and mental health outreach programs support the physical and mental health and well-being of people who are experiencing unsheltered homelessness. Roles and responsibilities for private land vary slightly, and there are some differences, but many of them are the same. Private property owners identify and inform the region of encampments on their private property. They provide the notice of dismantling and removal for encampment participants, and they also clean up and dismantle the abandoned encampments in most communities. And so what we do is we work with private property owners when needed to support this move. The Regional Fire, Durham Regional Police, and primary care outreach teams tend to have the same strategy highlighted in the roles and responsibilities for private and public land. The local area municipalities usually notify property owners of any violations or requirements for removal of encampments on their property. Moving beyond encampments, Part B of the encampment strategy really speaks to highlighting the journey that we need to take to move beyond encampments. So that's focusing on adequate housing for all, collaborating with the local area municipalities and partners, service planning, creative land use and collaborations, and implementing the Integrated Homelessness System Action Plan. Homelessness encampments are a reality due to the lack of affordable housing. Homelessness in the region has significantly increased since 2021. In Durham, we have 187 shelter beds in the system and the capacity to offer approximately an additional 30 hotel rooms on any given evening for seniors or families who are unsheltered. In January, at least 806 people in the region had consented to be on the by name list and receive services to end their homelessness. It is important to note that over 93% of those individuals are considered to have mid to high acuity, meaning that they need supports to end their homelessness. And this may be due to chronic homelessness and long-term homelessness, or physical health, mental illness, or addiction needs. Encampments are not endorsed as a solution by the region or this strategy. Encampments are managed to support people to move indoors with an aim to eliminate them. Thank you.
Thank you very much, Lisa. Questions to the presentation, as we do have a report further in the agenda. Hearing none, seeing none. Thank you very much, Lisa.
Thank you.
And now I'm going to call upon Tracy Greig, Chief Executive Officer from Durham Region Nonprofit Housing Corporation. She has two presentations, and first is regarding the successful partnerships, acknowledging key partners, and the second is the complex tenant challenges pilot. Good morning, Tracy.
Good morning. Thank you very much. You know, every now and then we have to take a moment to acknowledge some of the things that are working really well, because it's a tough go out there for most of us. So today I'm here to acknowledge a few of our partners that have really been making a difference in our community housing organization. You all know, oh, thank you. You all know, I think, in this room who we are. We are one of the larger providers of community housing throughout the region. We have approximately 18 townhouse and apartment sites with about 1,200 rental units. We have a tenant occupant family base of around 3,000 people living with us. We serve the demographic of seniors, families, person with disabilities, singles, and just over half our portfolio is subsidized or rent geared to income, with the balance being very low affordable market rent. I think you've probably seen our properties as you've gone about the region. I guess no need to go into those. But honestly, our partnerships are really one of the keys to our success, and I know this is probably true for all the community housing providers out there. And really, it's not just about the physical housing. I mean, that's a very big part of it, but it's also about the social and economic factors, and it's about trying to bring stability to those that live with us and improve their quality of life, both individually and for the community that they live in, the site they live at, and for that community as a whole. With some of our partners, a good number of them are resident on site with us, and that makes a very big difference. And we find with our partnerships that really work, it's really not just transactional. Our partners really care. They really want to get into the life of the people that they're trying to help to make a difference. And I think these comments that I'm making right now will flow into my next presentation a little bit. So I'll reserve saying a little bit more about that at this time. We have lots of partners. I couldn't put them all up there, but there's lots of them. And today there are three that I would like to acknowledge in front of everybody, because they've really gone and made the extra effort, and they're really helping the people at our sites. The first one is Brunchkins. It's hopefully known to everybody, but if they're not, this is around food security. Brunchkins provides free breakfasts and packable lunch for children during the school year on Tuesdays and Thursdays. And a child can come and get breakfast on a Tuesday morning, and they can make their lunch for Tuesday and their lunch for Wednesday, and then come back and get breakfast at Brunchkins on Thursday and have their lunch looked after for Thursday and Friday. Brunchkins also, when the kids show up, it's a very extremely positive space, and they're encouraging the kids to go to school and to do all the good things that we want to see our kids do these days. They also encourage community engagement through their partnerships and collaboration, and so it's almost exponential in terms of what they bring to the table to try and help our residents. We provide common space and a kitchen, and Brunchkins is currently providing 2 programs for us. One is at our Bowmanville Heights location, and one is at Normandy Heights in Oshawa. And a little shout out to the region. We didn't have the common space at Normandy Heights, so the region has a seniors building that abuts the property with common space and a kitchen, and they let us use it for this purpose. And we don't say no if there are any seniors that would like to come down and grab a lunch or a snack as well. So kudos to Brunchkins. I would like to say they have a great group of volunteers, and they need funding as well. So if the opportunity ever comes up through what it is that you're doing in your roles to fund Brunchkins, I would say it's a really positive thing to do. They really make a difference at the sites. The second partner that I'd like to acknowledge is VHA Home Health Care. They are partners with us in terms of eviction prevention and extreme cleaning. They are amazing. There's lots of services that they offer. This is particularly one stream. They have extreme cleaners who are trained and experienced to work with our tenants who are at risk of eviction due to the condition of their unit. And we have a growing number of tenants that sort of fall into this category as we're going forward in time. VHA has a very compassionate home care approach. They try to make the home health and safety focus for the tenant, with the goal of making sure that tenant has housing stabilization going forward. They give significant support with discarding unwanted items, cleaning in preparation for treatments of infestations, and honestly, we couldn't do it without them. They're amazing because when we call, they're there, and they really do make a difference. The other partnership is a long-standing partnership for us, as I'm sure it is for many people in the room through the local housing organization as well, but this is Durham Mental Health Services. They currently run seniors programs at our sites. This is a comprehensive support service for our seniors who have mental health and addictions concerns. They run a hub model and they tap into their multidisciplinary team who might not necessarily be resident with us, but it's available. And we have them located at 2 locations. One is our Whippy site at Perry Terrace, and the other is up north in Cannington at Allen's Place. They are enhancing and extending independence and improving really the overall physical and mental health of the residents in the buildings that they are resident in. But also by providing the space, they have outreach into the community around around our specific sites. So these are just 3 partners. I could really go on. I probably have 30 that I could say. And I'll just end with saying we really couldn't do it without the region. It has been an amazing partnership that we have with the region, and honestly, it's just getting better as we go over time. The region is becoming extremely innovative, focused, and just jumping on the issues that are making a difference or causing us concern in community housing. And so really we couldn't do it without the region's housing group. So Stella, to you and your team, I thank you. And Aaron, I would like to acknowledge your support as well. It's really making a difference for us. So that's my presentation in terms of acknowledging a few of our partners. I'm sure they'll be thrilled to welcome any encouragement you care to give them or any funding that you can pass their way. That's the end of that presentation.
Thank you very much, Tracy, and you are absolutely correct. We can't do it unless we're doing it together, and it's great to for the acknowledgement for the partners as well. Any comments or questions? If not, please proceed.
Okay. The next presentation, I'll tell you, it's going to be really hard to fit it in a few minutes. But I'm excited to be here. Even though we're 9 months into this particular pilot, we've had some really good results. And I think I'd like to start by saying, as a community housing provider, these days just providing a roof over somebody's head or a place to live is not enough. We have many tenants who face complex issues, and often we're the only resource that can help them at the end of the day. And so as a community housing provider, this is a serious and significant concern for us that led us to wanting to figure a way to do this a little bit better. I'd like to start by sharing something which, since it's this particular committee and the people are from housing and related departments here, you'll recognize this. We're a community housing provider, and this is only one tenant's particular story. This particular tenant was a lady in her senior, basically, who had mental health and addiction issues, and was very belligerent, had significant health issues on top of everything. But at the end of the day, we were the ones that ended up housing this particular person. And we housed her in May of 2023, and within immediately, her issues became known to us. And 3 months' time, there were like 88 calls to the ambulance service for support. She kept falling down due to her addictions. She was incontinent, and her unit was an extreme mess. From our perspective as the housing provider, we tried not to let her down. We biohazard cleaned her unit multiple times. We brought in pest control multiple times. We connected her with services multiple times. But there was a point at which this particular person even had some of her supports withdraw because they didn't want to approach her in this unit. She was an unapproachable person anyway. But what do you do with somebody, a tenant that's living with you when it's this dire circumstance? We made sure we were there every day as best as possible. We did the best that we could, but ultimately this tenant ended up dying in her unit after only just 8 months of living with us. It breaks our heart, but this is just an example of some of the things that we run into out there as a community housing provider, and we are not the only provider that experiences this. It goes right through all of those that provide our kinds of housing in the region. We are not alone in this, and so I think we all recognize that the complex tenant challenges are significant, and they seem to be getting worse, more severe as we're out there. No need for me to go through this list. It's everything from mental health and addictions through crime, through domestic abuse, you name it. There's really quite a list. And I don't think there's any community housing provider who hasn't experienced some of these or all of these at the same time. And so this led us to say, hey, what can we do that's a little bit different, because we have to do something. Our resources are getting strapped. People are dying in their units. And I will just say as an aside, we have many tenants that are just wonderful. But we have lots of tenants that, need some help. So we put together just a little bit of initial data with the help of EMS, the police, and the fire department. And this is just one site up in the north of our properties. And you can see over a very short period of time, we had a total of 147 calls for help. So many other things in the data stream, but this is what led us to have a conversation with the region. We started with Elaine and Stella and invited the emergency services team to the table. And at the end of the day, we were able to come up with a way to deal with this over at least a 1-year period. The region found, through the HPP program, $300,000 for us to run a pilot to try and address some of these complex tenant challenges situations. And with that money, we were able to hire a few specialists. In total, we hired 4 people. 3 of them were community support specialists with significant experience in mental health, addictions, and education, and outreach, and housing and homelessness, all who have been around the horn for a long period of time dealing with this. We also hired someone with that skill set, but also additional life skills and group facilitation. And we established a whole program around this with different goals and methods. But I think instead of reading this particular slide, I think the main takeaway is we need to help our tenants where they are at. That means where they live. Some tenants who might have significant complex issues can't wait 8 months or 12 months to get to a specialist for their help. They might not even be able to get to that specialist. So one of the key things about this program and all our specialists is to actually go where our tenants are at. I think there could be a whole presentation on how we have been developing their trust enough to be able to get them to agree to help us or to let us help them. At the end of the day, tenant engagement is absolutely key. And maybe another time I can come back and talk about that a little bit. But this program has had some amazing outcomes in 9 months. We've reduced emergency service calls. We are reducing RGI terminations. We are preventing evictions. We have a lower acuity of the complaints and conflicts that are coming forward. Our tenants at the sites that we are providing these services at, they know where to go for help now. They are connected to our resources They're connected to the resources now in their community that they've never been before. And we have tenants who are now having to have some of their more complex issues. They're being resolved in a way that's positive for them and that they can become a better and good member of our community. But I think it's important to look specifically at some of the outcomes. You have to bear with me while I just grab that slide so I can read it myself. So in 9 months, we basically are maxing out on the caseload that our specialists can help. And we're not only handling some of the tenants who have complex issues at our own sites, we are reaching out. We have quite a number of tenants now from Durham Local Housing, and we've made the offer to other nonprofits in the region to try and help them. We seem to be becoming, through this pilot, a center of expertise to really help the tenants where they're at. And again, it's making a difference. I would just like to go to the little chart that's in the presentation. We're working closely with one of our partners, which is the police in the region. They've been amazing. We're starting to really develop a good partnership as we go forward. And we have our complex tenant pilot happening at 6 of our sites. There are 3 sites here where I would like to show you some numbers. So you can see pre our pilot, which was January to June of last year, there were a high number of calls to the police. Look what happened once we put our complex tenant pilot in place. Those number of calls have been reducing almost up to the neighborhood of like 50 to 60%. And we're only really just getting going in terms of trying to take the measurements of how the program has been successful, because we very much want to have our funding for year 2, which I think we will, as long as the government is kind to the region and passes the money through. But we're making a difference. And I also would like to say it's still not enough. We need more, and we need to expand even further out to all the other providers in the region. We're trying to make and prove that case with helping some of the local housing, Durham Local Housing, and a few other providers. But I'll just say again, in some cases, it's pretty dire out there as a community housing provider. So the good thing is we're helping some tenants. This program is working, and so the model of helping tenants where they're at and having experts in mental health and whatever those complex problems are is really a good solution. And I think it's funny, as I sit here and I listen to some of the other presentations, I'm hearing that's what we need to do, bring the services to where the people are, because that's what's really making a difference. So I'm hoping that after year 1, or maybe once we get into year 2 a little bit more, I'll have some better data to share with you, but I can assure you that in 9 months, this program is successful. So now I'm on to where are we going next? So we're, of course, looking for our funding for year 2. I'm hoping that's going to happen. But we know we need to expand on our partnerships, and in particular, our volunteer programs. Partnerships, we need to bring more partners to the table. As we get better communication with all of them, we're getting more attention. We're able to help our tenants in a faster way than they otherwise might have been helped otherwise. But we can't run all the tenant engagement programs with 4 specialists. We're getting tapped out, and we're not only just using those 4 specialists, we're using a lot of the other resources that are in our organization as well, bringing those to bear. But we need to count on volunteers, and so we're currently working on a significant volunteer program. Yes, even our tenants, but also members of the community to come in and try and help us run some of those programs, because we know through those programs it helps us build trust and bring our tenants and whatever their major concerns are to the table so that we can help them. And I think if I had to say, what are some of the takeaways these days in community housing, it has to be more than just housing. It has to be housing with some help. And we are trying to get to the tenants who have these issues right where they are at. We are trying to work on community building. We are trying to eliminate any evictions due to some of these complex problems. We're trying to help with reducing the number of calls that emergencies services make to the sites, including police, including EMS, and even fire, to be honest. And so I think it's working. And I hope to get back to see you soon where I can tell you a little bit more. But I really thank you for the opportunity to let you know how we're doing. And I'd like to again acknowledge the support of Elaine and Stella and Aaron and the whole team who saw that there's a real need for this and helped flow that initial funding to us to make this pilot get underway and to have some of the successes that we do up to this point. That's my presentation. Thank you.
Thank you so much, Tracy. Councillor Brenner.
Thank you very much, Madam Chair. Excellent presentation. Having worked in the social housing field for 40 years, actually, in community services and human rights, I want to ask you a couple of questions as it relates to the pilot. When you're hiring your specialists, how many specialists did you say that you're bringing into the organization?
With the funding, we were able to hire 4.
Each of the specialists are assigned their dedicated expertise. Am I correct?
Yes, but they're all very well versed. It's pretty rounded out and similar from one specialist to the next, with the exception of the addition of some life skills and group facilitation in one.
Okay, the reason I'm asking the question is I want to get to the other piece of it, that the previous community housing model that Durham would have had used to have community services built into it. I don't know if they were called community service coordinators similar to Toronto Community Housing, but I know that previously they were called community relations officers or community relations workers, providing similar to what you're talking about. At that point in time, I believe they might have had, I think, 1 or 2. I can't remember because I think it was Debbie McLeod would have been with your organization at that point in time. Are you looking at establishing a community services unit within the organization, not as a pilot, but I guess the pilot migrating into a permanent fixture back into the organization, back to what should be there? And if so, am I correct that currently you are relying solely on external funding from other sources? Do you see that as bringing it back in, but perhaps looking at permanent funding for some stability? And if so, what can we do to assist you? Back then, it would have been the split between the province and a municipality or a region, but currently, obviously, it's all region.
Yes. So in answer to your first question, do we want to make this permanent? Absolutely. Do we want to become a center of excellence, not only for our own organization, but for all of those in community housing in the region in this regard? Yes, because we feel it's important, we feel it's working, and we're proving that right now. In terms of funding, we're solely funded through this first funding tranche from APP for $300,000, but we have added our own resources to that on an ongoing basis as well. And we really couldn't do it without some of those extra resources. So would we like some additional funding? Yes, 100% we could really use it, because and this is why I think I'm here today, Councillor Brennan, is to tell you that this model is working. And yes, Toronto Community Housing has something similar, and it works for them as well. And I think the other motivation for being here today is, I will speak for my organization, but maybe a little bit for some of the other community housing providers. It's tough out there as a housing provider these days, and we are one of the only ones that house some of the more vulnerable people in our communities, and we need to keep doing it. It's our mission and our passion, but we can't do it without these kinds of things happening, because we know to be successful, not only in our housing, but for our tenants to be successful in their lives, these things have to happen. When we can help them address some of these complex issues, it improves all the other social factors, essentially, which I know this team know very well.
Final question. In becoming a center of excellence and assuming that you're able to bring it within with permanent funding, are you also looking at sale of services? When you were talking about providing the services to other organizations, would you be looking at a business model considering a sales service to the other organizations as a revenue generating tool to offset the costs? I know that's something that Toronto Housing was looking at between their organization and some of the nonprofits because of the expertise. Would that be something you might be looking at exploring, which could help to offset the costs and perhaps bring it in-house even faster?
Yes, I think it is incumbent upon us to look at anything that helps us offset the costs. I'm not sure if I completely understood your full question. I don't think there's money from any of the other nonprofits.
No, what I was looking at is if the staffing model is being absorbed by the Durham Community Housing and providing the supports, whether it's tenant engagement, specialization, linkages, counseling, whatever,
Yes.
Let's say to Durham Municipal Nonprofit, who doesn't have that they would purchase the service of the specialists to assist them. So basically on a case by case.
If they could do that, we would welcome that. I
I
think,
just use that as an
yes,
example.
yes. If they could do that, we would welcome it. I'm not sure that they can. And so I think we're challenged to try and figure out how we can keep this going so that it becomes permanent, becomes a center of excellence, and we start to improve all the social requirements that we need to for those that are living in our kind of housing.
I want to thank you. The program sounds amazing, something that I
Yes.
wholeheartedly support,
Great.
200%. And certainly, I'm hoping that you can bring it in-house and make it a permanent fixture.
Yes.
Because you're right, the need is greater today than ever before. And most certainly, we're much more than just bricks and mortar.
100%. Thank you, Councillor.
Thank you very much, and thank you to your staff.
Yeah, thank you.
Thank you. Any further questions? Counselor Dias, you want to press your button? Just hit request. Is it working? Oh, there you go.
There we go.
You're on.
Thank you. Wondering, Madam Chair, if we can forward this presentation to Regional Council, if Tracy can do that. And the reason for that is, as stated in the presentation, there are many not-for-profit housing corporations experiencing these issues where there's really nowhere for these tenants to go. They can't live independently. And some of them are ending up in our homelessness shelters. And I think it's really important if we can reach more people in the housing industry and who are working on the homelessness issues, maybe we can start making a difference. Because this is really a very new initiative.
Okay, so moved by Counselor Dias and second by Chair Henry. All in favor? And that is carried, so we'll make those arrangements. I'm also going to be asking after the next presentation if we can bring Aaron back as well too okay. Chair Henry, seconded. Counselor Dias. Any opposed? So Aaron, you're already going to be coming back to us. Tracy, thank you very much for the presentation.
That's
and
great.
look forward to having you back for all council to hear what is taking place and for the education component of it. So
Perfect. Thank you very much.
And next I'm going to call upon Aaron Vallant and Aaron, Durham Regional Local Housing Corporation, and Alicia Scan, the manager as well too.
Thank you very much. Through the chair, I am going to introduce Alyssa Scan, who is the general manager for our Durham Regional Local Housing Corporation, who's going to share information with all of you on the work that is happening within the DRLHC portfolio to support tenants and also to create complete and thriving communities. One of the things I would like to highlight or put into perspective before Alyssa begins her presentation is currently we have two staff. There are housing program coordinators that are supporting 1,300 units, almost double that number of tenants within our DRLHC portfolio. And with Durham Nonprofit Housing Corporation has 4 support staff. So in total, there are 6 staff that are supporting this work and supporting tenants across the sector. But we know that there are more than 6,000 total community housing units across the sector. We also have more than 500 private units through our rent supplement agreements and thousands of residents that are in receipt of portable housing benefits. And all of those tenants across all of those different programs need this kind of support. And this is an important area of growth in our role as service manager. So with that, I will hand it over to Alyssa. Thank you very much.
Hi, I just wanted to actually start and say thank you to Tracy for the presentation. You'll see after this presentation that we are speaking the same language and agree completely. So my name is Alyssa Scan. I'm the manager of the Durham Regional Local Housing Corporation. I did want to say thank you for having me here today to give an overview of one of our exciting initiatives that we have at our sites designed to keep people housed, create a sense of community amongst our tenants. So Durham Regional Local Housing Corporation is the largest community housing provider in Durham Region. We manage a substantial portfolio of rent-geared to income housing. Our portfolio offers over 1,300 rent-geared to income housing units spread across our vast region. We have units in every municipality throughout the region. As a current 100% rent-geared to income provider, we serve individuals and families who have significant barriers to securing and maintaining stable housing. We believe that housing someone is really only just the beginning. We offer dedicated support staff to increase the chance that the tenant will remain housed. We're all well aware that the demand for affordable housing far exceeds the supply, which highlights the urgent need to have dedicated staff members focus solely on keeping those residents housed once they get that valuable resource. So our housing program coordinator roles in DRLHC were created back in 2017 from an identified need for community supports in our various community housing buildings and complexes. At that time, the property managers were the ones that were handling building operations as well as trying to support the tenants. It was clear there was a gap in service and the tenants would benefit from having dedicated staff to help meet their needs with the ultimate goal of preserving tenancies. This also gave the property managers the opportunity to focus solely on their role. We currently have 3 property managers and 2 housing program coordinators supporting our 1,300 households. The challenges that our tenants face are complex. Some are without any legal forms of ID, they're unable to complete taxes, no family doctors, they don't possess digital literacy, just to name a few of these. These barriers are further complicated by living in low income. It's not enough just to house people who need housing. We need to think longer and harder about how do we keep them there. What role do we play in this and how can we help grow our supports to keep tenants housed? The housing coordinator role truly plays that vital part in navigating the complexities of human need. We know that the overarching main responsibility is eviction prevention, tenant support, and program coordination, but the position encompasses so much more as the tenants' needs are varied and complex. As DRLHC breaks ground with expansion and redevelopment of many of our sites, and as we prepare for growth in tenancy, our resident needs will also continue to grow alongside these housing expansions, and we must ensure that the supports we are offering continue to grow and expand as well. We need to adapt to the ever-changing landscape that is housing. So a day in the life of our housing program coordinators. So once a resident secures rent-geared to income housing, this is where the work begins for our housing program coordinators. The role is imperative to assess tenant need. Simply put, again, providing that home is not enough support for barriered residents. Frontline and in-home tenant support is essential to ensure tenants are empowered with resources to maintain their housing and to thrive in their new communities. Once tenants are housed, our goals are to keep them housed, assist with system navigation, and prevent evictions. Every tenant under DRLHC is able to tap into these supports with the primary duties and responsibilities of our housing program coordinators to manage tenant case management, including providing direct support to tenants with referrals to services, conduct home visits to ensure stable and safe housing, assist in complex service navigations with CRA, OW, ODSP, OAS, CPP, and other income sources, coordinate with the property managers and act as that liaison between the landlord and the tenant, advocate for the tenant rights, organize community meetings, plan and implement on-site programming, eviction prevention, mediate conflicts between tenants, help complete annual renewal packages, create and seek out opportunities for community development, engage tenants with community programming, and provide the program coordination piece. So this brings us to the next point, which is taking a look at some of the challenges that our tenants face. One challenge that reoccurs with many of our tenants is the need for that system navigator, a human person to assist with navigating some complex government systems, such as income types, OW, ODSP, OAS, GIS, CRA. For any of us who have tried to call CRA for any of these government assistance, you know that these calls can be quite lengthy and often lead to some kind of roadblock. There's no one perfect chart that spells out how you manage and get through these different phones and phone lines and overcome the obstacles and barriers that presents to tenants. So our housing program coordinators will sit beside the person, make those phone calls with the tenant, and help them walk through exactly what they need to do to get their taxes filed, get their income sources regulated, and make sure they're getting all the funding that they possibly can because they're all low income. Another major challenge that we face day to day is pest control. As you can imagine, in seniors buildings in particular, we are housing tenants with varying abilities. As a response to this, we offer preparation services for tenants who are unable to prep the unit themselves. I don't know if you've ever had bed bugs or cockroaches, but if you do, in order to treat them properly, you have to do a lot of prep work, including like all of your laundry needs to be done and bagged, all belongings need to be bagged up. You need to remove things that can't be treated and heat treat them. And seniors with often accessibility needs can't do this themselves. So our housing program coordinators will go in and help them, walk them through the process, and then we hire contractors to assist with this as well. We have to get very creative when we're trying to treat these units. It usually involves a lot of inspections, follow-up, brainstorming, as well as leveraging community agencies to try to get the units clear. It's important for the tenants to be treated, but also for their neighbors, as we know these pest control issues will just spread rapidly if we don't deal with them immediately. We find ourselves balancing the needs of the tenant with the needs of their neighbors and the building on a regular basis. Tenants in housing are not immune to the rise of mental health struggles. We know this is seen across the board, but it's especially prevalent in vulnerable communities. What we're finding is that when the mental health takes a front seat, people are often unable to provide their own system navigation or complete the tasks that they know are required to keep them housed. By providing the supports of this position and pairing that alongside with the community programming that our tenants need and deserve, we know that this has a positive impact on people's mental wellness and sense of purpose. Much like tenant needs, the challenges we face supporting our residents can also be quite complex. At its core, the housing program coordinators are tasked in meeting residents where they're at, and I know that term is thrown around a lot in social services, but it's especially fitting for these positions because they're literally meeting tenants in their homes. When a need is identified, the housing program coordinators will continue to work with that tenant to address the issue. It's of value to note that tenant participation and supports are very voluntary. Tenants have the right to self-determine involvement with any of the work, which is why relationship building is an imperative component to this position, and it sets the position apart from the other community agency work. When you connect with residents in their home, you're able to build that rapport and trust on a much deeper level, which can eventually lead to some of our most vulnerable residents agreeing to the much needed supports. There's a fine balancing act when considering tenant rights and also their needs. We respect the wants of our tenants and offer the support from a person-centered lens and always prioritize their wishes and referrals and supports. The tenants of our buildings, many of them would fall through the cracks without the advocacy and supports that the property managers, program assistants, and housing program coordinators provide. I would also be remiss if I didn't add here that a deep sense of community is an overarching connector to the human needs of our tenants. That brings us to our community partners and collaborations. An essential role of the housing program coordinator is to bring in community supports and partners so that these supports are offered where tenants live, which will increase the likelihood that they will attend the programs and get the services that they need, not only to survive, but to thrive in their communities. So this is a list of some of our life-enhancing services we've been able to provide to our tenants by working in partnership with local community agencies. DRLHC and our partnered agencies share the same goal of tenant well-being. We're often serving the same population group, therefore working in tandem to provide the support from these agencies creates a mutually beneficial and long-lasting partnership. Most importantly, we meet with and hear the needs of our clients directly from them and offer programming accordingly. So we reach out to our tenants, find out what are their needs, what do they want offered within their communities, and then we go out, find these programs and services to bring to them. Tenants and housing program coordinators co-create partnerships based on identified need. So instead of going through this list item by item, I'm just going to highlight 2 communities where we've seen a lot of growth through partnerships and one program that continues to have a great impact across our whole portfolio. So first, one of the buildings we've seen a lot of growth in is our largest senior building at 155 King Street East in Oshawa. It houses over 165 residents. It's located right downtown Oshawa. Being as it's our largest seniors building, the needs of its residents are very varied and unique. We have partnered with Lakeridge Health and Durham Mental Health Services to provide ongoing case management to our senior tenants. We also have community care hubs at this site, as well as several of our other senior buildings. At this site, we have a paramedicine program that visits the building monthly and has resulted in decreased 911 calls, amongst other benefits. We've also had a tenant-led community kitchen program that serves coffee, tea, and breakfast items and snacks multiple times a week. We've held several health fairs, which provide information from many local agencies and services aimed at making these more accessible to the residents. At any given time, if you drop into the community room at this site, you'll be welcomed by tenants playing cards, doing puzzles, having coffee together, or more formal programming such as in-chair yoga. All of these resources work in tandem with the work that we do in the building, providing that ongoing support to the residents which is needed. The building has undergone extensive renovations over the past few years, which has presented some unique challenges. The relationships that we built with the tenants in the building have worked to our advantage when we're dealing with the ongoing disruptions from renovations and capital repairs. The second site we're going to highlight is our Lakeview Harborside community. This is our largest family site. It's located right along Lake Ontario in Oshawa. It consists of 173 townhomes and a small apartment building. We've had several opportunities over the years to engage community development projects. In 2018, we partnered with Tamarack Institute, which is a leader in creating community to conduct local deepening community initiatives with the goal of increasing community engagement. This led to partnerships with various agencies, but most importantly, partnerships with the tenants who live in the community. We have a thriving tenant association at this site called Harbor Love, and they hold various community events. Several tenants are heavily involved and work very hard to engage the rest of the community members. Many community events occur at this site with everything from arts programs for children and adults to community cleanup events, jiu-jitsu programming focused on empowering youth and preventing criminal activity, and many more services. Lastly, our community volunteer income tax program is gearing up for its 8th tax season. So a requirement of receiving rent geared to income housing is to submit annual renewal packages, which includes reporting income through tax assessments. So if a tenant essentially doesn't do their taxes on an annual basis, they can lose their rent geared to income subsidy, which then would mean they are going to pay market rent, go into arrears, and eventually lose their housing. So in response to the challenges with having tenants complete these, we now have a thriving volunteer-free income tax service. It operates year-round, and we're able to provide our tenants with the opportunity to have their income taxes completed for free. We've cultivated relationships with several amazing volunteers who continue to come back to the program year after year. And we start planning for the tax season in January and hold in-person clinics at the majority of our buildings. We also offer free drop-off services year-round. We started that service during COVID when we were unable to hold the in-person clinics, but its popularity continues to grow as residents recognize the convenience of simply calling a housing program coordinator and saying, "My taxes are ready." It's incredibly convenient to be able to offer this service to our residents to ensure that they have the proper documents for their annual renewals, but also that they're receiving all of the financial benefits they're entitled to, such as the children's child tax benefit. So future planning, where do we go from here? So tenants who need supports across various health and social service areas often experience challenges in navigating different systems and coordinating the supports that they need. This includes supporting seniors who are aging in place and increasing instances of hoarding that significantly impacts pest control challenges. Neighbor conflicts are also increasingly common and can disrupt community vitality. Providers do not have the capacity or resources to be the primary support and case manager for tenants, and they don't know who to call to get support or provide sufficient community building events and activities to foster the sense of community and help build relationships. The Region of Durham plays a crucial role as the service manager to lead and support the community housing sector in Durham to ensure its long-term viability and vibrancy. After 8 years of developing these positions, it has become so clear how pivotal they are in keeping tenants housed. Our responsibility to housing providers goes beyond housing the tenants. We must foster collaboration and create more tenant-centered supports. Partnered housing providers look to the region for support in tenant care. It is our responsibility to assist in balancing the tenant needs within all of our community housing portfolios. Doing so will ensure a balanced community housing system where no one organization is overwhelmed or under-resourced. We know that these positions foster successful long-term housing stability. Currently, the Durham Regional Local Housing Corporation tenant support model only involves 2 housing program coordinators. We know that more resources are needed both within our portfolio as well as the larger community housing sector. The work that both Durham Regional Local Housing Corporation and Durham Region Nonprofit Housing Corporation is doing is a model that can be scaled to wrap around the whole sector so that all tenants and providers have access to the supports that is needed. The need to support our housing providers is a call to help that needs to be answered. As a service manager, it's an important area of leadership to provide more support, proactively coordinate community services, and provide needed training opportunities for all of our providers. This work is so important to assist with vibrant and strong communities. So, in conclusion, what we're hearing from our tenants is that this role is critical in creating the lasting tenancies. These roles have been uniquely set up, and although they work alongside the landlord and property manager, the housing program coordinators are able to be that good cop, meeting tenants where they're at and truly being the supportive person that the majority of our tenants haven't been used to having. Truly taking the time to foster meaningful relationships with the tenants and residents contributes to a greater sense of community. Not only is that beneficial to the tenants, but it's also beneficial for landlords who benefit from the advocacy and eviction prevention provided by the housing program coordinators. Thank you for listening. I apologize for that.
Thank you, Alicia, and Aaron as well, too. Is there any questions? I am not seeing any. We will now move on to delegations. I have Maria Papiano, and Director of Rights for Vapor, and she is online. Maria, you have 5 minutes. Oh, your microphone. We don't hear you. On the bottom of the screen, you should be able to do request to speak, correct? There you go. One moment, and there you go.
Okay, well, thank you, Chair, for getting my last name right. That is a rarity for me, and I appreciate that. My name is Maria Papaioannou, and I am the Director of the National Advocacy Movement, Rights for Vapors. Our mission is to ensure that Canadians who use safer nicotine products have access to them, and the 3.2 million Canadians who still smoke have access to honest information about alternatives to cigarettes. It is this commitment that has brought me here today. On January 25th, Durham Public Health posted a tweet stating, "Vaping harms your lungs. Short-term effects of vaping include coughing, shortness of breath. Long-term effects include lung damage and lung disease. It's never too late to quit." This tweet was flagged with community notes, and over 54 comments debating its content were removed by Public Health's social media department. Why would they silence an open discussion on an open forum? More disturbingly, why would a public health authority share blatantly false information? There is no credible evidence that vaping causes long-term lung damage or disease. A deeper look into your social media reveals a consistent and troubling trend. Your messaging conflates smoking and vaping. This is not just misleading, it has consequences. Understanding the fundamental differences between smoking and vaping is crucial for informed decision-making, especially for adults when it comes to helping them make the choice on how they want to quit. Traditional cigarettes burn tobacco, release thousands of toxic chemicals, including tar and carbon monoxide. These substances are directly linked to lung cancer, heart disease, and COPD. Vaping does not involve combustion. Instead, e-cigarettes heat a liquid containing nicotine flavorings and other ingredients, producing a vapor, not smoke. This crucial difference results in significantly lower levels of harmful chemicals compared to cigarette smoke. While vaping is a far safer alternative to smoking, the Royal College of Physicians and Public Health England have both concluded that it is at least 95% less harmful than smoking. Health Canada has indicated on its website that switching completely to vaping nicotine is less harmful than continuing to smoke. Your public health unit should be providing accurate, science-backed information, not spreading fear, suppressing debate, and misleading the public. Misinformation costs lives. It's time to stop conflating smoking with vaping and start focusing on tobacco harm reduction. I want to take a few moments to address the website Not an Experiment that your organization uses plenty of times to share misinformation. I have flagged this to Health Canada as an issue requiring immediate attention. Public health messaging must be rooted in truth, not fear. It's important to note that the slogan, "Not an Experiment," was the same slogan widely used by millions of people around the world who refused vaccination during COVID. A troubling association between the two that should not be ignored. The Cochrane Review, one of the most rigorous and respected sources of scientific analysis, has consistently found that e-cigarettes are one of the most effective tools for quitting smoking. Their latest report confirms that nicotine-containing e-cigarettes help significantly more people quit compared to traditional nicotine replacement therapies like patches and gums. The evidence is clear. Vaping dramatically increases the chances of long-term smoking cessation, leading to fewer withdrawal symptoms and greater satisfaction among users. This is harm reduction in action, yet your message ignores these facts and instead misleads the public. I urge you to listen to adults who vape. Bring in the lived experience into your conversation. Stop conflating vaping with smoking in your communications. Include the voices of people who still smoke or may vape, many of whom who still smoke continue to do so because they believe misleading narratives like the ones that are shared on your social media that vaping is just as harmful as smoking. By doing this, you are gatekeeping the truth and actively discouraging people who smoke from switching to safer nicotine alternatives. I believe that this misrepresentation is deliberate because I believe that smart people work at your organization. Today, 100 people will die from tobacco-related illness. Not a single Canadian has died from vaping since 2010 when it was introduced to this country. Your focus should be on tobacco harm reduction, not on policies that push people back to smoking. I want to say thank you for taking the time to listen. You are one of the largest public health units in our province, and you should be role models, and you should be able to inform, not moralize on issues. Thank you.
Maria, perfect timing of 5 minutes. Well done. And
Thank you.
Thank you very much for sharing your feedback. Is there any questions? I have one question for you, Maria. So the information that you shared about the tweet and all that, have you had any communication with our staff here at within our health department?
I have a history of trying to communicate with them, and I also have a history of not being communicated back. So that on me, that I'm using past experiences to decide on what I can or cannot do. But this topic about vaping with Durham Public Health is usually a contentious one in the past, and it was hard for me to go down that route. And I thought this would be a best practice. And I used the example on social media where they shut down the commenting and removed everything they could that was contra to what their position was.
Okay.
So maybe I made assumptions, and I apologize about that.
Okay. No, thank you for sharing that. All right. Thank you for presenting this morning. And as you know, it's part of our record as well, too. And feel free to reach out.
Perfect.
Thank you very much.
Thank you.
You're welcome. I'm going to move on to the next delegation. Shelley Mayer, CMO and VP of Eastern Region, and Jolene Livingston, founder and CEO, Partners Affordable Housing. And you are in person. And you have 5 minutes.
Good morning. Thank you, Madam Chair, and to the rest of the committee and the Health and Social Services Committee. I am Shelley Mayer, and as was said, I work for Partners for Affordable Housing, and I am the VP of the Eastern Region and handle marketing and communications. I would love to introduce you today to my colleague, Jolene Livingston, who founded this organization in Alberta, and we're collaborating together to launch in Ontario.
So thank you for taking the time. So we want to introduce you to Partners for Affordable Housing. We're a relatively new but very ambitious organization, as Shelley mentioned, founded in Alberta. Our mandate is really accelerating investment in community housing through what we call P4 partnerships. And that's community housing providers, public sector, private sector, and philanthropists working together. And while we know there's a lot of work happening with providers and with the government sectors, what's absent, as we've seen, is philanthropists and corporate community investment from the housing equation. And that's the role that we want to play in getting more units funded. Nobody needs to tell any of you, and having heard some of the presentations here today, that housing is a crisis in this country and it's only getting worse. There are 4.4 people in need of affordable housing, and we're really focused on the 3 million that are low or very low income. What we've learned through our work over the last 5 years in doing the research to stand up this organization is that for nonprofits, stacking and scaling investment to get housing to market is not just challenging, it's almost impossible, and many, many units are lost every year. The competition for limited funding through traditional sources like CMHC, federal government and provincial governments, and municipal and some organizations or in some regions is incredibly fierce. And those who can offer the most scale are generally going to be the recipients of the funding, though the funding is limited and may not accomplish what all is needed. We're also seeing that access to social capital is limited. There is philanthropic funding out there, and there are families that are turning their attention to this crisis, but not a lot of nonprofit affordable housing agencies are able to have the resources within their teams to actually access this capital. How am I doing for time? Can you see the? So we have a national solution that is both national and regional because we know housing is very unique to the jurisdiction that it's in. We want to do for affordable housing what's been done nationally for food security and health. And we have two examples here of two organizations that work both nationally and regionally in terms of cause marketing as well as philanthropy. And they're raising upwards of $100 million every year for their respective causes. We want to do the same for affordable housing. We're based on a case study inspired solution. So I'm from Calgary, as I mentioned, and in Calgary, there was a campaign that ran between 2012 and 2018 called the Resolve Campaign, where 9 agencies came together under one umbrella to raise, they wanted to raise $120 million. They ended up raising $300 million. 75 million of that came from philanthropic capital. Within that, governments also showed up to the table and were really adaptable to what they were doing and incentivized their building projects. So over 6 years, 9 agencies raised about $300 million. It cost $1 for every $25 that was raised. 21 new buildings were opened. The last one opened last year, and nearly 2,000 Calgarians were housed. The downside of this approach was it was a limited term, it was intensive, and they disbanded. And we've done the research since the campaign came to a close, and a lot of that philanthropic funding has dried up. It's no longer being funneled into affordable housing. But there's a will to do it, and it's re-emerging in Calgary, and we're working in Calgary and area and out in the Canmore region to take on the same kind of campaign approach. So our goal is to support a continuum of affordable housing with capital and capacity building grants. And what we mean by that is direct infusion into capital projects, but also pre-planning funds and potentially rental supplement funds so that we can really support a range of housing that could come to market as quick as possible. Sorry, I'll just go back real quick. There's a delay. Sorry, there's a delay here. Oh, sorry. It's you that's driving.
Sorry, do you want me to go back?
No, that's okay. We're really focused on emergency shelters to affordable rental housing, so non-market housing that's at least 30% below market. Next, sorry. So we facilitate collective action for change. Our mandate is threefold. Collective investment is really where we want to make a difference, and that's really about bringing social capital to the equation and allowing for that stacking and scaling to happen faster and accelerate the opening of doors. We know that philanthropy offers much more flexibility than traditional granting sources, and it can be much more enterprising in terms of how it's utilized. Collective Voice, we would love to run national campaigns, but we'll also do regional that are of the size and scale of Bell Let's Talk Mental Health. Our goal is to put assets in the hand of every nonprofit that wants to work with us to co-brand our marketing assets and push them out into the community to dispel housing stigmas and myths and raise awareness about we're all 1% degree away from somebody that's either housing insecure or has been housing insecure in their lifetime.
So I'm just going to let you know your 5 minutes are up, but I see you have a couple more slides. So if you can be cognizant of the time, we'll permit you to carry forward for
Great.
the
Thank you
next
so
couple of
much.
slides.
The one last thing is we want to build a national repository of projects. We want to be able to showcase to every philanthropist where they can put their money to work quickly. Okay, my colleague says we're landing here. So we are looking for innovative communities to work with. We're working in Canmore right now, as we mentioned. We have a philanthropist that's funding our work in Calgary South. We know that everybody's looking for a unicorn, and a unicorn does not fit in a program box. So we don't fit in any one program box within the federal government, within the provincial government, but we know we have something that works. We've done it before for other cases, and we can do it for housing too. So we are looking to engage in enterprising communities that want to work with us in the first stage of community collaboration to bring your nonprofits together to see if there's a will to work together, formulate a campaign, and we will then work with you through philanthropic dollars that we have to execute that campaign in your community. I will stop there. Thank you for your time, and I'm sorry I went over.
No, that's fine, and it's very important, the conversation as well too. Is there any questions? I do. What conversations have you had with our staff about this project?
We have had one introductory meeting with Tracy's team, and as well Erin and a few folks from her team participated in that discussion. It was actually Erin's suggestion that we come here today and make this presentation. And so we're grateful for that and hopeful that our conversations will continue positively there.
So just because with your presentation, it sounds very similar but different to Habitat. How different are you except for the programming? Like, it is very similar in terms of just the format, is it not?
I can speak briefly to that, and you can jump in as well. So Habitat is typically building homes people are moving into and purchasing. Our focus is on deeply affordable and affordable rental units. There are a variety of ways that those rental units can come to market very quickly. We are not replacing the nonprofits that are creating those housing solutions in communities, but rather we're helping them replace funding gaps. So like Habitat, we are a fundraising organization, but unlike Habitat, where the project funding is going specifically to Habitat projects and the way that they've framed that, our funding will be granting out to nonprofit housing providers in communities to get those projects to market. And as Jolene said, that could be rental supplement funds, it could be pre-planning funds, it could be the capital stacking. And, you know, we talked to Tracy about a project in her community that fell short and basically the pro forma couldn't work and had to be scrapped. We want to bring that capital gap to the table through philanthropy and through corporate community investment. And we have had early conversations with many folks that are interested in investing in housing, but they don't know where to begin. If you're a national philanthropist, one with, you know, one of the big last names that any of us would recognize, and you want to help solve the housing crisis, where do you start? Because it's very regional and it's very different in every community. And so if you have you know, an 8 or 9 figure gift that you want to put to housing across the country, they don't know how to navigate that. And so we're the middle kind of broker, if you will, that is connecting the dollars with the housing projects.
So you're like a community foundation except for housing?
Yes.
Okay.
Except we're proactively fundraising,
Right.
like knocking on doors.
And then informing people.
Yeah.
Appreciate it.
Yeah, it's a good example.
Yeah, yeah. I appreciate that.
Yeah.
Any questions? I'm very intrigued with this. This
Great.
is.
Thank you.
Councillor Dice.
Oh, it's on now.
There you
There it
go.
goes. My question would be is how do you intend to bring the not-for-profit organizations together?
We have a full engagement process where we start with interviews, we do some roundtable conversations, we build a strategy, we test the strategy with them and with funders, and then we write essentially the story of affordable housing in your community. It's work that we did with providers in Calgary. There's 60 providers of multiple size and scope, and we had 35 of them come to the table. Their common concerns were none of them really want to be fundraising. They don't have the resources. It's not their skill set. It's not how they were originally set up to operate. The second concern was there's not enough pre-planning dollars out there. So even if we want to get into the build scenario, it's really difficult and expensive to get started. And we also heard, there's a third one that has now escaped me that was significant, but it was, we don't want to fundraise. We need the dollars. We don't have the pre-planning funds. Oh, and some of them actually don't want to be building either. Some of them get into building because they have long client lists that they can't help with their programs because they don't have a roof over their head. So we also heard from them that they'd be very patient to let the first projects go first. So those who have the most momentum can kind of open doors in the first 12 to 36 months, would be prioritized for capital investment, and the others would wait their turn to come through the queue as long as there was a revolving queue. And so we're not suggesting a campaign, we're suggesting an enduring campaign until the problem goes away, which will probably be after I retire, but somebody else will take on the reins.
So would that, excuse me, would that include conversations with ONFA then to help that process?
Yeah, and we've already talked to ONFA. We've talked to a lot of different municipalities. We've talked to provincial organizations, national organizations, and we're really, we've spent the last 3 years really doing a lot of due diligence to see, A, if anything, what we're suggesting exists, and the answer has been definitively no, and B, is there a need for it? Definitively yes. And then the question always is, who's going to pay for it? And I'll share with you, we have, in the last year since we actually incorporated and got our charitable status, we've raised $2.25 million just to get our operations up and running. So,
Well, thank you. It sounds very interesting. Look forward to see how it evolves.
Yeah, thank you very much. Any further questions? I'm going to be reaching out to you.
thank you.
Yeah, I'm
Thank you
intrigued.
very much.
Mr. Ward, come on forward. Oh, you dropped something on the chair. On your chair, you dropped something. On the chair where you just stood up, you dropped something. You're welcome. Good morning, Mr. Ward.
Good morning, members of the committee. I appreciate the allowing me to speak. I had a flooding issue in Kendall, and it never got resolved. It was, the lot across the street from me was filled with contaminated fill. They flooded me out, contaminating my well. I have a picture that after 6 weeks, this is what still existed. Councillor Anderson did a walk around. I don't know how he could walk around the street. I was flooded in the middle of this. I spoke twice at Police Services Board on this matter. Chief Martin said it was a civil matter. The matter is 30 truckloads of contaminated fill filled the property across the street, filling the ditch, reversing the flow of water, contaminating my well, contaminating the well across the street at 44 Monk. He's got a new well. The town workers are coordinated by the person at 40 Monk. they took the soil that was on, they took out 10 loads, but refused to put the flow of water back where it was. They put the 10 loads at 24 Monk, and the second new well was put in October at 9 Monk, across the street from 24 Monk. This is town workers refusing to adhere to municipal standards. I spoke with a man named Clint Peters, who was supposedly in charge. The workers refused to listen to him. He's quit. He knew exactly what was going on. The workers refused to listen to him, and they listened to the person at 40 Monk because there's a couple of retired town workers living in the area, and they sent bylaw after me 10 times. They terrorized me. They refused to apply the bylaw 321A, which says you cannot fill within 1 foot of the road allowance. I get a registered letter from the town. I had to build up the area in front of the house to divert it. I mentioned it at Police Services Board that I had to build a berm because they filled up one side. I had to fill up around the house. They filled it higher. I filled it higher. And then they filled it higher. And then I filled it higher. I get a registered letter saying I'm in violation for defending the flooding, yet the people that caused the flooding have no consequence. And they refused to rectify it. This is 5 years later. I requested to speak to regional council, but I lost on a recorded vote. The chair of the Police Services Board, Kevin Ash, basically known him my whole life. The second person from Pickering was Bill McLean, who was real estate agent to Deer Creek, was one of my issues. I've spoke many, many times at regional council regarding Deer Creek. All my concerns were received for information, no action taking. In the meantime, there's a major contamination issue in the area. I had a letter on June the 4th, 1919 from MOE or whatever they call it now, saying I was in violation for having a contaminated well. I built the berm to correct my well problem. And I said, how can it be a violation to have a contaminated well and not be a violation to bring in 30 loads of contaminated fill? It came from Concession 3 in Middle Road. In 2017, there was a preliminary environmental report that estimated $5 million to haul the soil to Hamilton. A year later, they got a better environmental report, and they hauled the bottom of the pile, the slime, to this lot here. And I thought it would, I spoke 3 times at Clarington Council early in 19. I thought it would rectify. Bylaw come after me 10 times. The work crew built resurfaced the road, built it off the road allowance, refused to identify where the road allowance is, they pushed the snow still to this day off the road allowance because this neighbor at 40 Monk had control of these, of the workers.
Mr. Ward, you're
yes.
at your 5 minutes.
Okay.
Okay.
Could I add one thing?
You may add one thing, yes, please.
It's a totally separate item. I submitted 2 emails. It's basically a worldwide humanitarian interest about if anybody's interest in saving Ukraine or allowing Ukraine to maintain its independence. I have 2 very simple emails. It's about banning Russian hockey players from the NHL. Hockey in Russia is the number 1 sport, no question.
Thank you, Mr. Ward.
If you could read those emails and just consider a resolution from the entire council, I would appreciate it.
Thank you, Mr. Ward.
Separate issue. Thank you.
Do I have questions from members of council? I'm not seeing any, Mr. Ward. Dr. Kyle, do you?
Nothing to add.
Thank you very much. Mr. Ward, thank you. And I would suggest that you continue your discussions outside with the staff as well, too.
If you could consider
Okay, thank you very much, Mr. Ward. Now moving along, and under health, we have no correspondence. We have a report, and this is from the Durham Paramedic Services Special Events Coverage. Can I have a mover on this? Chair Henry, seconded by Councillor Brenner. Or questions? Any opposed? Seeing none. Next, we have correspondence, and I will also add that we just approved this motion as well too at Whitby Council for the PACE program, and I believe we're working to bring Mr. Malash to do a presentation on the PACE. Moved by Councillor Brenner, seconded by Councillor Dyes. Any questions? I would encourage, Chair Henry.
No, I was just going to move both.
Okay, thank you. Okay, so we'll deal with this one. Any opposed? Moving on to the Durham Region Encampment Strategy, moved by Chair Henry, second, Councillor Anderson. Any questions? Thank you for the work that's been put into this as well too by all the municipalities and staff, and I think it's a great document for guiding us collectively as a group. Any opposed? Any new business? Councillor Jubb.
Thank you, Madam Chair. And through you, I'm just wondering if staff could give us an update on applications for the at-home incentive program and when we can expect successful results of that.
Did you hear that? Okay.
Yeah.
Can you
Through
just
the
clarify
chair,
what the ask is?
yes, you'd like to know about the at-home incentive program and the status of that, correct, Councillor Jubb? We are
Yes,
bringing
please.
a report to the Committee of the Whole in March with that information.
Okay, thanks for that, Stella. Thanks. That's all, Madam Chair.
Further. Our next meeting is April 3rd, and I will just let others know that Vice Chair Dyes will be chairing that meeting. I will be absent. Moving to adjourn, Chair Henry, second, Councillor Anderson. Oh, I moved you up to chair. Any opposed? Oh, there you go. Thank you and have a great day.